which structure passes through that labeled area which is labeled as area B? So what is this labeled area? Very good. Gayu, everybody, welcome. Area B is lesser sciatic foramen. To the lesser sciatic foramen, pudend nerve is the one which will be passing. Very happy to see Divya, Gayu, everybody, and every Sunday we'll have a challenging All India exam pattern test, and 9 to 12 and 12 to 2 a discussion on the paper. So this tradition we had been into for the past 1.5 decade, past 15 years, and every year composing new questions and some old questions and creating a question paper as close as possible to what examiner really is going to give in the exam. That is the challenge on which we keep working every week. So doctor, there is a structure A. What is the structure? Iliotibial band. So what is the muscle which is attached to the iliotibial band is the question. Gluteus maximus is the one which is attached to the iliotibial band is what I want to underscore to all of you. Now you have been shown a cardiac cycle. What is this parameter which is falling and then rising? Most likely it is a left ventricular volume. At the time of systole, the volume will fall down. At the time of diastole, it will increase. And that is how it is in sync with the heart sounds. Between S1 and S2 you call systole, or S2 and S1 you call systole? Between S1 where mitral valve closes, aortic valve opens, and the blood is pumped, you call it as systole between S1 and S2. So that is the time where between S1 and S2 the volume is falling, hence it is a ventricular volume, is what I want to underscore. Now doctor, in the saliva various electrolytes had been given. Which electrolyte will have the least concentration of all? So what is the label D represent is the question of the examiner. Potassium is the least, sodium is the highest, and in the middle falls the bicarbonate and chloride is what you need to basically remember. Now this is hectoin agar. We have an organism A. On hectoin agar, if the organism is a lactose fermenting organism, then you get this color. Whereas a non-lactose fermenting organism, a non-lactose fermenting organism will be like this, and I'll show you, lactose fermenting organism will be like this. So it is the E. coli on hectoin agar, because it is a lactose fermenting organism, will typically be giving this appearance is what you need to basically appreciate. Now you have a shuttle system. Whenever FADH2 gives its electrons, there is production of only 2 ATPs. So what is the cause for that? Basically FADH2 become FAD, and in the process there is a conversion between dihydroxyacetone phosphate and glycerol 3-phosphate, and once more the interconversion of that will translate into transfer of the electrons. So this is typically called the shuttle system for the transfer of electrons from the cytosol into the mitochondria. If it chooses the dihydroacetone phosphate to glycerol phosphate shunt, then FADH2 is produced, and that will produce only 2 ATPs. That is what you need to appreciate. There is one more shunt which is called malate shunt. Suppose the NADH produced in the cytosol chooses the malate shunt, then the malate become oxaloacetate, become asparatate, and once more there is a NAD regeneration, and this system is more efficient. It will produce 3 ATPs. Earlier system will produce only 2 ATPs. That is the point you need to understand. Now this is a question on glycogen synthesis. Gayu is saying, I had a different question paper online. Okay, online test paper, is it not the same paper? It is the same paper, no? I think Divya and Ramya can clarify whether they had the same questions online. Same. Maybe Gayu has clicked on the previous last week's paper and might have solved it. But that cannot happen because we will move the last week paper into the practice papers and introduce a new paper into the examination system. Very good. Amrita, Shazia, everyone say in the same paper to go ahead. In fact, we have around 100 plus question papers of our Sunday mock test which we discussed years together. In fact, we have many more of discussions, but we have hosted all those discussions and question papers in the online question bank. You can always take a chance. Every day also you can practice one question paper. But every week we will freshly prepare. Like fresh dosha, and dosha we bring and heat it. Like that, fresh dosha will make every week and then serve you hot steaming so that you are fully charged to prepare entire week. If you can score at least 75% in our question paper, no one will stop you from getting into the top 100 ranks in the entrance exam. Okay, doc? Now, first we will finish the image based questions. The label B, which is stimulating protein phosphatase 1 and driving the things to form glycogen synthase A into active form, leading to glycogen synthesis, then what should be the substance A is B is the question. So fundamentally, if insulin is there, when will insulin be there? Whenever you eat well. Whenever you eat well, you will get a lot of glucose in the body that will stimulate insulin. Then what should insulin should do? It should store all that glucose you have eaten in the form of glycogen in the liver. So how will insulin will tell the body to store all that glucose you have eaten to convert into glycogen? Insulin will go, protein phosphatase 1 it will stimulate, which will convert a phosphorylated glycogen synthase B into dephosphorylated form. Dephosphorylated form is active form, phosphorylated form is inactive form, glycogen synthase enzyme. So this glycogen synthase A, which is dephosphorylated, will in turn lead to glycogen synthesis because it is an active form. Whenever you are exercising, you need breakdown of the glycogen, not synthesis. So synthesis should be stopped. How will body will know? Whenever you are exercising, epinephrine is produced. Epinephrine will stimulate cyclic AMP dependent protein kinase that will phosphorylate the glycogen synthase B and convert it into inactive form. And if it is in inactive form, it can't lead to glycogen synthesis, and glycogen synthesis will be stopped, is what you need to basically appreciate. Now doctor, conversion of phosphoenol pyruvate to glucose. You had been given a pathway. I hope the images are clear in the online test engine also. Before week we had a issue on that. So I hope online students must tell me whether the images were clear in the online screen, just like the actual national board exam. That's right. So you have a substance A which is stimulating, substance B which is inhibiting this conversion of phosphoenol pyruvate to glucose. So what is that substance A and B is the question. Fundamentally you must learn, you must know about the regulatory, what are the regulatory enzymes in every pathway. Glycolysis, gluconeogenesis, glycogen synthesis, breakdown, fatty acid, beta oxidation and synthesis. All this biochemistry must become a puppet in your hand. It hardly takes 12 to 15 hours of your time. We have got about 43 topics in biochemistry discussed and put on online video library. Very high yielding topics, where if you go for all India exam, the 15 questions come from that 43 topics only. Or if you go for state entrance, 5 questions come from that 43 only. But to revise that 43, in 12 hours we have revised it and put it on online video library. So you can always revise it and don't postpone biochemistry later, physiology later because I have read it long back. If you postpone, it becomes little difficult and challenging. So doctor, AMP and fructose 2,6 biphosphate inhibit this process of phosphoenol pyruvate to glucose. ATP will typically stimulate the conversion of phosphoenol pyruvate to glucose. Is it understandable? It is understandable. Why? ATP, that means you have abundance of energy already, right? Do you need glucose breakdown? Whenever you have got the ATP, you don't want glucose breakdown, right? So that is the reason phosphoenol pyruvate towards glucose is what kind of process? Glucose forming process, not breaking process. So when you have lot of ATP, you don't need glucose breakdown. You want a glucose formation so that it can be stored as glycogen or various forms. So that is the reason when ATP, which is a marker of abundance of energy in the body, is there, it will not let further glucose breakdown but further glucose building. Hence it will stimulate fructose 1,6 bisphosphatase is what you have to basically appreciate. Now doctor, 83-year-old lives in his home, develops pneumonia after the influenza and his sputum sample is being sent. Last 1 week was a great challenge for me. My mom, she had a complicated urosepsis with UTI. So finally we are running imipenem drip and praying God to save. And from 20,000 counts came by second day to 15, 12, 10. Just now I have given the last dosage of imipenem drip and coming. So especially elderly people, when UTI is there with the backdrop of diabetes, generally how do we evaluate? Okay, diabetes is there, hence UTI is there, so you will get a urine culture and start some antibiotic. But that is not enough. You should invariably do a ultrasound. Why? Because in spite of diabetes, there could be a stone which is precipitating the UTI. There can be a stone, there could be an obstruction, there can be a hydronephrosis, there can be a pyonephrosis. If any such thing is there in the kidney, then you need to drain it, clear it, then only sepsis will come down. Otherwise only giving antibiotics will not suffice. Patients will think, what a commercial doctor, he is getting for a UTI, a CT scan abdomen and ultrasound. What is the need is what outsiders may comment, doesn't matter. You have to evaluate. Sometimes a small stone will be there, we don't know, but that stone is the precipitating factor for recurrent UTI. We think elderly person no, diabetes no. we expect UTI. There is nothing expected in medicine. Always attack the cause is the rule which you should always remember. So luckily there were no hydronephrotic changes in our case when we did ultrasound. It was a UTI, but a very fulminant form of UTI with the patient going into urosepsis. Always doctor, elderly people, children, if you intervene at a very early stage, you can err on the side of being aggressive. They will have a wonderful survival. One day you lose also is like losing. Patient goes into ARDS, goes on ventilator and dies on ventilator. So that's a point. Okay. So you are all going to be top intensive care physicians down the line, and application, continuous application of what you read onto the patients, and sitting and thinking why I lost that patient, probably what I would have done to save that patient, always should happen every time you lose a patient. That's very important. Okay. So doctor, what do you see in the sputum of this patient? Diplococci. So it is a streptococcus pneumonia. The most common cause for the post-influenza pneumonia is what you need to basically remember. Now, basically we are showing how the ADH acts. Now there are two drugs which are inhibiting the action of ADH. So simple way of asking the question is, what drugs will interfere with the action of ADH on kidney and that lead to nephrogenic diabetes insipidus? Which drugs are responsible? Basically it is demiclocycline and lithium is what you have to basically remember. Then there is a dose response relationship. Sedation, hypnosis, anesthesia, coma. Which is this drug C, which does not lead to hypnosis, anesthesia and coma? It is the buspirone, which is safer compared to that of benzodiazepines and barbiturates, because it does not lead to coma or anesthesia, is what you have to basically remember. Hence buspirone is used as a anxiolytic agent. Now doctor, which disorder is associated with the blood picture shown? First of all, what is this blood picture? Are they RBC, WBC, platelets? Only three types of cells only, no doctor, in the blood. They are all platelets. Abundance of this many number of platelets is a sign of thrombocytosis. So indirectly we are asking, where will you find thrombocytosis? Platelets are broken in the spleen. If you do splenectomy, post-splenectomy, patients will typically show the presence of thrombocytosis is what you need to basically remember. Afternoon we have a wonderful class on neurology by Dr. Rajaratnam. Dr. Rajaratnam is from Madras Medical College, MMC. She is an excellent ophthalmologist, and her ophthalmology classes are like a favorite for students across the country. But she has 9 gold medals in undergraduation, the highest record ever achieved. So madam is capable of teaching any subject, and her passion is also into teaching general medicine. So ultimately what is important is a good teacher who can comprehensively revise. So today afternoon we have a short class, 2 hours of session of neurology from Dr. Rajaratnam with brainstem, stroke, etc. reviewed. So take an opportunity and give your feedback. Yes, Amrita says she is an excellent teacher. Absolutely, absolutely doctor. And I hope ENT is taught by Dr. Lenin every day evening 5 to 8. I hope he is also a very good teacher. and we have many more teachers to present and unfold before you to ultimately revise the subject and 1100 topics for you. Huh?